Greetings. Welcome to a conversation on COVID and development. And today it's my privilege and pleasure to welcome Karina Gould, who's the Minister of International Development in Canada, and herself somebody who has been championing the agenda for development for vulnerable people for many years. So, Minister Gould, welcome to our conversation. It's a real pleasure to have you with us.
Well, thank you so much, Masood. I'm really glad that we could do this and have this conversation.
Thank you. And I thought that we might start a little bit, Minister, with Canada had a very well-defined and quite focused international development agenda, which was sort of part of the Feminist International Assistance priorities. It focused on the women and girls, on gender equality, on interface between gender, women's rights, and climate action. So a range of issues that were really a very full agenda that you were pursuing. You're a big donor. You put in about $4.5 billion a year of ODA. Still, many people hope that over the next few years we'll see that increase, but you're already the ninth largest donor. So, and you have been very active in the international scene in trying to ensure that you don't just act alone, but that you try to build coalitions and move priorities forward in different ways. And then COVID came along, and of course, none of us were expecting in this, although maybe we should have thought a bit more about, global health security, but here we are. And it's affected everybody's lives in every country, and we're all thinking about what the implications are. And I thought we might just start with getting a little bit your sense of how has this crisis impacted your and your colleagues' way of thinking about international development? How do you see your own priorities changing both in the near term to respond to the crisis, but then also in terms of going forward for the next few years? So look forward to your thoughts on that.
Yeah, well, it's a great place to start because I think that as you mentioned, COVID has impacted everything we do. It's impacted everyone on the planet, and it's had an impact, of course, on development. And, when we just think about the way in which we do business, right? And the normal way of, having international development experts and humanitarian actors fly around the world, go to, communities and the scene of a disaster if it's a humanitarian issue, and provide assistance and technical guidance and, really engage locally and one-on-one in community. And, when you have shutdowns and the closure of airspace and the closure of borders, that's just not possible. So obviously, like everyone, we've had to rethink how we do development. But one thing that hasn't changed are our priorities in Canada. And we really believe that, the Feminist International Assistance Policy provides a roadmap in terms of what are some of the things that we can do to help alleviate, the suffering and the difficulties and the issues that people are facing right around the world. And, at the core of our Feminist International Assistance Policy is gender equality, but it's also reaching the poorest and the most vulnerable. And we know that, although COVID knows no borders, it absolutely has a greater impact on the poorest and the most vulnerable, those who are unable to stay at home because they depend on daily wages, those who have to feed their families because they don't have the means to save long term. And for countries that don't have kind of the fiscal firepower to support their populations through a shutdown, that's where we're seeing, really disproportional impacts, whether it's, because of migrant laborers in India who've gone back to their villages, whether it's, low income individuals in the cities in Brazil who haven't been able to stay home, or same with, migrants who are trapped at borders, because they've been closed, that we're really seeing a disproportionate impact. And so our Feminist International Assistance Policy has always been targeting those people, recognizing that, that's where we need to provide our assistance. And so that hasn't changed. And of course, we also see that, there is a gendered impact of the COVID pandemic. We're seeing soaring rates of gender-based violence. Children around the world have lost school as a safe place to go, whether that's either, from a difficult home situation or as a place to receive a balanced meal. That doesn't exist right now. And then we're also seeing, an increase in issues of access to healthcare, and that's disproportionately impacting women and children, whether it's with regards to sexual and reproductive health services or routine immunizations. So we really do see that our Feminist International Assistance Policy continues to be a guide in terms of how we respond to COVID, but obviously ensuring that we are continuing to be focused on the public health aspects, on the health aspect, but also on addressing inequalities, because that's going to be one of the biggest ways that the world will overcome this pandemic, is by getting to those who don't have access to healthcare, who don't have access to the information, the resources that they need to provide for themselves and for their families.
Yes, I think that's absolutely right. And as you say, we're already seeing, in the surveys that are being done, that if you're short of food in a family, it's often the girls that get shortchanged the most. If you look at all the kids that are out of school, I'm really worried that a large number of girls won't come back even when the school's open, and there's a risk of early marriage or just parents are being short of funds down the road, and some of that is coming through already in the sort of survey data. And I guess there's a bigger point you were just making, which is that when we start looking at the impact of the crisis, you see it disproportionately impacting the vulnerable, the marginalized. And so I guess one part of your agenda now is to try and make sure that your current programs are targeted more towards providing a balance, to the extent that you can. And then the second thing is that when we start talking about the recovery, there are going to be so many competing pressures on limited resources during the recovery that, again, the risk is that the vulnerable and the marginalized get left out. And I want to get a little bit of a sense of how do you think that Canada can help to shape the international realization of the importance of being inclusive in that recovery process, and both in general, and then we might talk about specific areas.
Yeah, well, I mean, look, I think that there's no moment in recent history that clearly illustrates why development assistance and global solidarity is as important as it is right now. And recognizing that tackling inequality, right, is going to be what we need to do in order to address COVID. Dr. Mike Ryan from the WHO says it best, right? Until everyone everywhere on the planet is protected from COVID, nobody is. And we have to see that not just through the lens of the global north, not just through the lens of working with developing countries, but even within countries, how are we getting to those who are most marginalized and most vulnerable? I mean, in Canada and other industrialized countries, where have we seen COVID really kind of ravage? It's in long-term care homes, right? And, those are our most vulnerable, most marginalized seniors who really needed to be protected, by the state. And so I think no matter where we're looking at this, whether it's in industrialized countries or in developing countries, we have to take, a human rights-based approach and an intersectional approach to this, because, it is our duty to protect the vulnerable. But also to understand what the impacts are, and whether they're frontline workers, in Africa or in Canada, we need to protect them so that they can continue to provide health services. They're really putting themselves on the line, and I think where Canada can play a role is through our continued leadership. One of the important things that I've been really pursuing is to ensure that we stay the course on our existing development programming, because as you kind of alluded to earlier, these issues don't go away. In fact, they're actually exacerbated by COVID. So let's take nutrition, for example, right? If we're thinking about, a girl child who was already kind of last in her family to get access to healthy food. Well, when resources are scarcer, you could bet that she's going to be even more at a disadvantage, right? And so we have to stay the course on our existing programming, because whether it's nutrition, whether it's access to support for HIV, malaria, tuberculosis, whether it's education, whether it's fighting climate change, whether it's food security, I mean, all of these things are just getting worse in the current environment. And so we can't ignore that, and we can't be solely focused on the health response to COVID. That's a big part of it, and we need to do that intervention. But for me and for Canada, it's been really important to keep that existing programming going to the extent possible, and then to provide additional support, which we have done. We've provided an additional $1.5 billion for COVID-related support, $1 billion to the IMF for loans for developing countries, and then $500 million in direct humanitarian and development response to address the COVID emergency is really important. We have to do that together, and that's what I've been advocating for internationally, is to really encourage my counterparts around the world to not forget about all of the other issues that we have ongoing, to stay the course as much as possible and to address COVID. But whether it's inadequate housing, whether it's inadequate access to healthcare, whether it's inadequate access to education. I mean, all of these are things that just worsen the instance of COVID. And so if we can do more, even if it's, shoring up and supporting care work for women in the developing world, that would help them, protect themselves and their family from COVID. So we need to think about this holistically, and that's really what Canada has been trying to do and trying to push internationally.
I think that is so important, this notion that we think about this holistically, because, right, in my mind, there's no question that we globally had underinvested in global health security before. People had been saying for a while that the WHO budget for pandemic flu in 2017 was somewhat smaller than the annual salary of the Michigan State football coach. Is something that Larry Summers who likes to make that point. And to me, that was clearly there's a signal in there that the world wasn't investing enough. At the same time, now we have to recognize that we're not going to create global health security by focusing narrowly on global health security. You have to really look at this as part of a broader agenda. First of all, that global health security has to rest on strong national health systems, and national health systems have to be broader. And then you have to think about all the other factors, the education, the nutrition, the income, because if you don't have a steady source of income, you don't have a way of reaching out to the households in time of stress, then they're not going to be able to do the kinds of social distancing and lockdown that we've been recommending in the early stages. So I think that broad view is clearly one that's important to keep pushing out. And I want to kind of narrow down a bit on one of the areas that I know you have been taking a lot of leadership on, which you mentioned, which is nutrition. And I know that you personally and Canada have been very much leaders in terms of getting the world to focus on how do you get better nutrition, particularly, again, for those who are most vulnerable. And it's not just the food, but it's also the right nutrients, whether it's giving them access to iron or vitamin A, which are fairly low-cost interventions that can have a huge impact on children's lives and as they grow up. And I want to get a little bit of a sense of, do you worry that that agenda is getting or could be a little bit squeezed out at the moment? Or how do you think about continuing to keep that focus going forward?
Well, what I think is so important is that we learn the lessons from past outbreaks, right? And so I I think of the recent trip that I took in January to the Democratic Republic of Congo, right, where I went and visited North Kivu, the center of the Ebola outbreak, right, and while everyone was focused, and rightly so, focused on the Ebola outbreak, at the same time there were 3 times as many children that died of a measles outbreak as there were people that died of Ebola in the DRC. And so it kind of goes back to this holistic picture, right? We have to be thinking about what are the implications of our response and what are we not doing and what does that mean, right? So we can't forget about nutrition, right? Because if we forget about nutrition, well, that means we're going to see higher instances of child mortality. We're going to see, other diseases. We're going to see other outcomes that are going to have, a significant impact on people's lives and livelihoods. And so, how are we supporting, whether it's continued public health information about breastfeeding after birth? How are we supporting those interventions in our food security? I think one of the keys for me is what are we doing to tie interventions in nutrition with food security. And so whether that's working through FAO, the Sun Movement, IFAD, the World Food Program to say, how can we link these interventions to make sure that they are responding to the need that are going to have a better outcome. And, one of the things that I have a local stakeholder in my riding in Burlington. I'm a member of parliament as well in Canada, and he runs our local food bank, right? And he always talks about the fact that food is health, right? And nutrition is the first vaccine, right, when it comes to good health. And so how do we make sure that we're building a holistic system? And I think that, one of the things that I'm kind of excited about, despite everything that's going on, is that this kind of serves as an opportunity to pause and to think and to reflect and to say, okay, we've got these amazing interventions in nutrition. We've got these great interventions in food security. We've got these really good interventions in providing routine immunizations. Like, we've done a lot of really good kind of targeted, specific interventions over the last 20 years. Now, how can we kind of connect the dots between them, right? And make sure that we're doing things in a more holistic manner. To me, if that's what could come out of the pandemic, that would be really exciting.
That would be a great outcome because, I have to say that I spent a lot of time over the years looking at development issues in different ways and from different perspectives. And one of the things that still strikes me as a big challenge is to get our development community working on any particular issue to really see the connections and join up that dot. So the holistic vision. And when we come together, the combined effect is so much larger than if we don't join up in ways that really make everybody feel good about it. But the process of coming together, and I remember when we were starting to have a conversation about the need to bring humanitarian assistance and development assistance together more. You'll remember this. It was initially quite a struggle for everyone to come out of their comfort zone. But today, I think we work so much better between humanitarian and development folk that you can see the big impact of that. And pushing that holistic vision of connecting the dots is really something that I think clearly you're doing, and you can also pursue through the design of your programs by forcing people in a way and encouraging them to think more broadly.
And that's kind of, when we think about like a feminist approach, right, to international assistance, it's about collaboration, right? Like, it's not about working in these silos. And I don't want to throw out the good work that's been done over the 20 years, because we've seen incredible decreases in maternal mortality and child mortality, and much better health outcomes. That's really good stuff. But I think what the pandemic is clearly illustrating is that the system right, is not as strong as it could be. And when I think about, as a Canadian, one of the things that we're most proud of is it's our healthcare system. It's primary access to healthcare and basic healthcare. And what is lacking in a lot of part of the world is that strengthened health system, right? And all of these different interventions are happening kind of independently of each other. And wouldn't it be neat and interesting if we could somehow connect them, right? And I think it would be quite powerful. And in some of the conversations that I've been having recently, it won't necessarily take that much to do it. It's just thinking about, okay, so this individual, while they're doing routine immunizations, could you also provide them the training to do nutrition interventions at the same time? Right? And if you can do that, well, maybe you can also train them to kind of monitor for and surveil for irregularities, right? Because they might, they're the community healthcare worker. They know their community, they know what's going on. And so we don't have to go, full scale, but you can start to connect the dots in kind of basic ways that could have really meaningful and impactful changes. And, I think about, the conversation that we've been having, for example, about Pakistan right now, where, the polio network, right, has pivoted to do COVID contact tracing, right? And so they've actually been quite successful in doing that in Pakistan. So, just trying to think about, okay, what are the existing systems and networks on the ground, and how can you leverage those to provide a more holistic response? To me, that's something that I think would be quite possible.
I think it would be a great outcome. But just to push that a little bit, I mean, part of it is joining up across different programs and different specialties, if you like. And as you said, I think unless you have solid base in each of those areas, you don't have much to join up. So, you got to have the successes that you're really trying to leverage by bringing them together. But the second part of it, which has also been a little bit of a struggle for, number of decades, is to make sure that donors who are active are also willing, and not just willing, but actually keen to join up and be part of a more coordinated response. So it's not, the Canadian health program here or the UK program or whatever, And that's also kind of ebbed and flowed over the years, right, in terms of people's willingness to do that. Now there's some people who worry that actually we're sort of going through a phase when in a number of countries people see development assistance much more tied to national strategic priorities, a little less multilateral, little more bilateral focus. I know Canada's always been a big proponent of the rules-based multilateral system, coordinated responses. How do you see that challenge? Do you feel are you comfortable with where things are, where they're going? Are you worried about it?
Well, I'm definitely worried about it. And I'll say that, even that debate is happening within Canada. Just this past weekend in the Globe and Mail, there was a full page opinion piece about, it's time for Canada to step away from multilateralism because those changes are happening, right? But I think, for me personally, and for our government, we've been very committed to multilateralism and the international rules-based order. But it's also about thinking about, okay, where has it been successful, right? How has it been successful? And where does it maybe need to adapt to the 21st century, right? And I think that's a fair conversation to be having. I don't think we need to throw the baby out with the bathwater because, if you think about what the multilateral system was intended to do at the end of World War II, it was to stop interstate conflict, right? And actually it was quite successful at doing that. But there's a whole range of other challenges that maybe are more challenging for the multilateral system, whether it's intrastate conflict or these kind of global challenges like climate change and this pandemic that require global collective action. And so I think that, again, there's this opportunity to think about, okay, how do our institutions maybe need to continue to evolve to meet these new challenges that, quite frankly, are facing humanity? Right? Whether it's a pandemic or whether it is, the existential crisis that is climate change, we will not be able to solve either of these if we don't solve them globally. And so how can we incentivize collaboration? How can we incentivize different countries with competing ideas to work together? These are all big questions that we need to be asking. And I think right now is the moment to do it. But certainly Canada as a middle power has benefited tremendously from the current international system. And, we've been able to, put our mark on it and help shape, how the world has responded to many different crises over the past 75 years. And so I think, again, as I said, it's not about getting rid of it entirely. I think it's about saying, okay, where are our strengths? And where are our there you I know, no one ever calls me. Hold on, let me turn that off. Okay. Go figure. Oops. Good thing it's not live.
That's all right. I think even if it were, people sort of now everything is good. No, you were saying that I think we need to really think about what kind of multilateral system that we need. And in a way, it does seem to me that, we believe in the value of multilateralism. And because we think it is an effective way of resolving a set of issues that affect each of us that we don't think we can do as well or even at all unless we act in a coordinated framework. And we accept that part of the price of having a framework like that is that our ability to then do what we want all the time is going to be constrained because that's part of a common set of rules. Many people today don't think that the multilateral system, as we have designed it, is working for them. Either because they feel that the issues that they are most concerned about, climate, health security, artificial intelligence and its governance, they don't feel that the multilateral system as we have it is doing a good enough job. So they try and find alternative ways, coalitions, trade, WTO. Right now we're going through the process of trying to find a new head for the WTO. And trade is an area where, if you see, the WTO has been really challenged for the last few years to be able to play the role that was envisaged. How do you think, you say Canada and other middle powers have been big drivers of that system. And I know now you're discussing formally, informally, in different ways with countries and to try and revive this. What do you think about the ways in which we could try and help to shape what the new multilateralism will look like or should look like?
Well, it's a really good question. If we think about why we came up with the international system in the first place, it was to constrain great powers, right? And I think it has been quite successful in doing so. But to do so, everyone has to agree to follow the rules. And and there aren't a lot of mechanisms to hold members to account, right? I think that's one of the big challenges, but that's also one of the big challenges in designing a system is members have to agree to what those accountability measures would be. And so I think what we have to, if this is a path we are going down, is to think about, well, what is the objective of the system we want to have? And then how do you design it to meet that objective? And so that's where I'm saying that, over the past 75 years, the system has been quite effective in achieving its initial objectives, but those objectives are changing now.
Right.
And I think this is where, when we're confronting issues facing humanity right? It's less about your nationality. It's less about where you're living in the world. It's just the fact that you're living on this world, that we need to be thinking a bit differently. And I think that's a very interesting conversation to be had, but you have to get buy-in from the major countries to make that a reality. And I think, particularly when we think about something like climate change, we've had some really positive agreements, but how have we been able to hold countries, industrialized and non-industrialized, to account for the commitments that they've made, right? That is a big challenge. And I think that, part of it and what we're seeing in the world is, people feel that in some instances, government or the multilateral system is not responding to the needs that they have, whether it is with regards to their health, whether it's their economic well-being, whether it's the opportunities that are available to them, or the climate catastrophe that's on the horizon. And so, how do we be more responsive as leaders to the needs of our constituents and our citizens? I think is a big question. And I think, it's always interesting to go through these exercises, but I don't have the answer to what that system.
Well, I don't think anyone does, Karina. I think the whole world is struggling to try and figure this out. But I think the key point is one I want to take away from what you just said is that we need to start thinking about multilateral solutions as a tool for achieving objectives that we have as individuals, as countries, as the collectivity, rather than as the objective in itself. And I think, maybe sometimes it's just a question of how we phrase this conversation, because it becomes as much about institutions and about structures than about what it is that we're trying to achieve through those institutions and structures. And I think part of it is also this sense amongst a group, substantial number of people, particularly in many rich countries, that the process of globalization and global forces, whether it's economic forces, trade, have not benefited them, and maybe they feel even worse than there. And I think there's some evidence to suggest that they, when not managed, they can have negative consequences for large communities of people. And the institutions that were set up to regulate global forces have actually been perceived to be promoters of those global forces instead. And I kind of wonder whether there's also a sort of refocusing of what is the role of international institutions. It's more to manage globalization rather than just to promote it. And maybe that will help to shift a bit the way people think about it.
Well, and I think a lot of I'm going back to my feminist international assistance policy here, but I mean, what you're talking about too are structures of power and inequality, right? And people feeling left out and feeling like they don't have access to decision makers, and they're not part of the conversation. And so I do think that's a large part of it as well. And, particularly in, the global north, so to speak, that, those who feel like they've been left behind from globalization is because they feel they've seen, their power within society diminished and increases in inequality, right? And so those are issues that, we have to tackle. I think in a really important way, just like we have to tackle the structures of power and inequality between countries, right? So I think that's part of the challenge, is that in many ways, the multilateral system that was designed to address issues between countries is now trying to address issues within countries. And it wasn't necessarily built for that purpose, but those are the issues that we are experiencing now. And so I think that for me, that's the big question, right? Is how do we, because and collectively we're facing a lot of the same issues, no matter where we are in the world. And so how do we need to think about this in a way that works for people, no matter where they live?
I can see we're going to have, these are very big questions that we will all be collectively and individually trying to contribute to over the years to come. And I think I want to kind of end by saying that in a way, you said something a while ago, which is really important, that maybe the COVID crisis is a moment for us not only to tackle the immediate causes of it and the consequences from it, but to use it as a trigger to reset the way we think about the broader agenda and the need to approach these issues in a more holistic way at a time when really a lot of our underlying assumptions and premises are being challenged by both a new agenda for the world, which is increasingly quite different from the one that the world had started with in 1945, and a new set of geopolitical relationships and actors on the global scene, and including the role of China in this, which require us to rethink how we work together to solve the problems that are common. So there's going to be a big agenda going forward. And I hope we will have many conversations about how we think Canada is going to be able to contribute and lead part of that conversation.
Well, absolutely. And I think, I was talking to someone much wiser than me a couple of weeks ago who was saying that in crises, you need to have your immediate responders, but then you also need to have the people who are thinking about how you avoid the crisis next time around, right? And I think that that is in essence what we're talking about right now, is we have our immediate responders who are addressing the issues, and we need to do that. But then we also need to be thinking and planning for how we build a more inclusive, more sustainable, more resilient planet. And that's what we need to be working on coming out of this. So, we're still not out of the woods by any stretch, we're still very much in the crisis, but it's important to have, people thinking about that for how we can, rebuild out of this and build something better moving into the future.
Minister Gould, I know there are going to be many people who are going to be rooting for success on that agenda. And I hope we'll have a chance in a few months' time to take stock and see how we're making progress on doing just that. So thank you very much again for taking the time to be with us today.
Thank you.